Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss clinical presentation of dermatomyositis. I will cover skin sign. Usually involve skin of the face, hand and extensors of limbs. The findings are facial rashes, eyelid erythema, oedema formation, nail fold changes, Guthrans papules formation, involvement of upper chest and back area, scalp erythema and hair loss. These are most common findings in case of dermatomyositis. While less common findings are oedema of the face, limbs, flagellate erythema, vasculopathic ulcers and mechanic hand. Eyelid involvement with erythema that is lilac in color is pathognomic sign of dermatomyositis. Macular erythema on upper torso of view of chest and on shoulders and upper back is termed as the shovel sign. I will discuss shovel sign later on. This picture describes the clinical presentation of dermatomyositis involving the face area. You can see the erythema involving the both cheeks area extending into the nose. It may also extend and move down into the neck and shoulder area. These erythematous changes are similar just like a lupus erythematosus. This picture describes involvement of scalp area in case of dermatomyositis. The scalp hair is characterized by non-scarring diffuse alopecia. Skin of scalp hair in case is the erythematous and shows some swelling. This picture describes clinical presentation of dermatomyositis involving the face and upper and lower eyelid area. Always note that the skin of the face is erythematous and skin of eyelid upper and lower is also erythematous. Moreover, there is a swelling and some mild scaling is also notable here. This picture also describes the clinical presentation of dermatomyositis, but it does not involve whole face. Only erythema of upper and lower eyelid with some oedema is also seen. Here note that the erythema is the dusky red in color. This picture shows involvement of upper part of chest area, anterior of chest, we usually called as a V of the chest area, showing erythema of the upper chest extending from one shoulder to another shoulder. This erythema involving the upper part of torso of back of neck and upper trunk on the back side is termed as the shovel sign. This picture describes involvement of nail in case of dermatomyositis. There are some findings which are seen in nails. These include periinguinal erythema, visible dilated capillary loop in proximal nail fold, hypertrophic and dystrophic cuticle, and small infarct are also notable. This picture describes picloderma. The picloderma is a situation when dermatomyositis is left untreated, the skin changes. These skin changes are termed as the picloderma. It is characterized by epidermal atrophy, dyspigmentation of epidermis, and telangiectasis. Erythema is also seen. Guthrans papule. Guthrans papule is one of the most important clinical presentation of dermatomyositis involving the skin of proximal interphalangeal joint and metacarpophalangeal joint. These Guthrans papule are characterized by the red or lilac color flat-topped inflammatory lichenoid lesion, mostly on the interphalangeal and metacarpophalangeal joint. They rarely develop on the palmar aspects of finger creases where they are known as the inverse Gautrans papule. This picture describes the Gautrans papule in proximal interphalangeal joint and metacarpophalangeal joint. These are lilac in color, flat topped papule. This picture describes another clinical features of dermatomyositis, which is characterized by the appearance of streaks of erythema extending from fingers and moving on to the dorsal aspects of hand. This picture shows vasculopathic ulcers on the digit finger. These vasculopathic ulcers are dusky, punched out ulcers, usually noted on the fingers and on the knuckle area. This picture describes involvement of extensor surface of upper arm and forearm. This is the most common presentation seen in men. Also note here that the involvement of hip area and upper thigh area in case of dermatomyositis. The involvement of hip and upper thigh area in case of dermatomyositis is known as the hosteler sign. This picture describes the extensive form of dermatomyositis. Here, erythema on the back of upper part of chest is noted, which is fixed. Thank you very much. Stay connected and subscribe my YouTube channel.